third COVID-19 vaccine could soon be on the market in the U.S. The FDA is now considering an emergency use authorization request by Johnson & Johnson. We begin our coronavirus coverage with Way 31's Megan Reyna.
She talked with doctors and who say that people should not hesitate to get the shot despite its low efficacy rate.
Johnson & Johnson says its single-shot vaccine is 72% effective against moderate and severe disease in the U.S. However, the vaccines already on the market are about 95% effective overall. But Dr. Sarah Nafziger with UAB says, if approved, to not rule it out.
And if that effectiveness is less than what's published for the Pfizer and Moderna products, if it's in the 50 percentile range, that's still a very effective vaccine.
She says it's important to note its reported ability to prevent severe cases.
And while it would be preferential for people to not catch COVID at all, that would be the end goal. But much more importantly is to prevent people from having severe disease and to prevent people from dying from COVID. And so those are the big goals.
Some people wonder if they can take the J&J shot in addition to the Moderna or Pfizer. Infectious disease specialist Jenny Marazzo says not to rule that option out yet.
There are studies being planned now that are called mix and match studies, where we're going to try to look at some of these things. But I do think that it's going to depend a little bit on when people get that second shot.
And while this request comes at a time when Alabama is in desperate need of more vaccines, there's still likely weeks of review ahead.
But there's still a lot of review that has to happen. The FDA is going to review it. So we'll have to just wait and see what they say after the final analysis is completed.
If it gets the okay from the FDA, the vaccine goes to the Centers for Disease Control and Prevention, which will decide if the vaccine is safe for the general public and who should get it first. Megan Reyna, Way 31 News.